So at Bear Health, you're not just building a tech product, you're reshaping health culture. What inspired you to create Bear Health?
Yeah, so like I said before, I've always been into health and wellness throughout my life. Former athlete, some of us would say that we're still currently athletes. And as you notice, a lot of people getting into running and run clubs and stuff like that now. But yeah, former athletes, so always relatively health conscious. My dad was really strict with us about what we put in our bodies. Like I didn't drink any Coke since I mean, maybe elementary school. Like me and my siblings stopped drinking sugary drinks and Cokes and stuff like that. Always, I was the person getting the shrimp salad or the shrimp pasta at the restaurant after our team games or what have you. So always been into health and wellness, but it has really been mostly for myself and my personal performance. And it was actually during the COVID-19 pandemic. My aunt had actually sent me a message while she was at work. So she's a physician's assistant. And she said, "Hey, nephew, I think this would be a great time for you to kick off your healthy eating initiative again." So I eat a plant-based diet. I have been for 10 years now. And so I'm the vegan person in the family. And so that's kind of why she spoke specifically to the healthy eating initiatives that I've done. And um, I took that seriously, right? So we're all sitting in the middle of a pandemic, and the virus is preying on the most dispossessed and unwell among us. And what stood out to me the most was that the majority of the conditions, the comorbidities that put people at risk for severe outcomes from the COVID-19 virus, are preventable. And hypertension, type 2 diabetes, cancers, that these things, you know, assuming that you're able to live well, these aren't conditions that you have to have, right? Just because something is common doesn't mean that it's normal and that it should exist. Obviously the majority of us have one or more chronic condition, majority of adults, but that's not, that's not just the way it is. That is the way it has become as a consequence of what we've created. But fortunately, at any age, you can slow, stop, and reverse the trajectory of these conditions. And I know that. And I've watched it happen. I used to work in a plant-based heart clinic in Houston, where people would come in with type 2 diabetes. They'd come in with hypertension, and they'd be prescribed medications because medication does have its place. But we do need to help manage these states so that people can not have a significant health event like a heart attack or a stroke or something like that and end up in the hospital. Like, we do need medication to manage these things. But in addition to being prescribed medication, the physician would prescribe a whole food plant-based diet. And there's a kitchen connected to the clinic and everything. And people would come down or off their medications in a matter of weeks. Just from changing their diet. And so I've seen it happen. I know it happens. And because of that gave me the confidence to want to build something, again, so that next pandemic or next challenge that we face, we're just in better health, right? We're in a better state of health to have a better outcome. Like, the healthier you are, the more effectively you can engage and contend with reality, whatever is thrown at you. And so, my first thought was, I don't think we know how bad we're doing as it relates to our health in the Black community. I know we should be exercising more. I know we should be eating better. But I don't think many of us know that if we don't get it together soon, we can have a heart attack at age 45. Our bodies are aging faster in the Black community as a result of everything that we experience here and our lifestyles. And my biggest fear is my friends, losing my friends, right, as we get into our these, and their children having to live without their parents from a young age, from a preventable condition. My mom's good friend lost her husband to a stroke at age 46, leaving their 13-year-old son to have to grow up without a father. It's already hard enough, right? Life is already hard enough. And to lose a parent to a completely preventable condition, on the whole, it's I regard it as unacceptable. And so I've made it my mission to prevent it.
Yeah, I appreciate that sentiment, and I think it's very, very important. And I also think it's important to understand, like, a lot of people do know, like, they have to do things that are better, and they do know, like, what they're doing is unhealthy, but they also are in an environment, or they have the systems around them. Like that, I think, for example, just about the recent One Big Beautiful Bill, and they proposed cuts to SNAP. and how that is going to affect so many families, so many black families, so many poor families, so many rural families, so many urban families, but disproportionately rural black, Latino immigrant
Mhm.
families. You know, SNAP was in many food banks was like what every one meal that a food bank was giving out, SNAP was giving out 7 to 9 meals. So how do you envision the work that you're doing to work to also improve maybe some of the systems that are able to allow people to achieve better health?
Mhm. Yeah. It's a good question. I may have I guess, a hot take on despite the system being what it is, you can still be black and well in this country. And I say that because, um, we've known the conditions. The conditions have been what they are since we got here. They used to be much worse. Maybe now they're a little bit better. And at the end of the day, and in part of like what we're trying to communicate with our platform and our brand is that your health needs to be self-directed. It's on you. You determine your health, and we need to help people understand why we need to make it a priority, despite what we're up against. My grandfather is 87 years old. He grew up in the Jim Crow South, right? He used to tell us stories about how they would require literacy tests for voting, and he said they would ask them things like, on the literacy test, you're thinking that it's going to be,
No, it's ridiculous questions.
you know, yeah, you think it's going to be, write your name, spell the presidential candidate's name, something simple, right? But it's like how high is high, right? How many marbles are in this glass jar? You got to know the exact number, or you're illiterate. And so, he's faced everything that you can imagine someone face in this country, but he's 87 years old without a single chronic condition because he's chosen to educate himself and prioritize his health, and he's benefited from it. And so, as there are going to be constantly changes that make our lives harder. That's just the reality that we live in, because there are people with what I view as terrible ideas that are just as committed to those ideas as we are to the ones that we believe in, that we believe are good for everybody. And so what I hope that in this context we're able to do, because we are a startup company, we're a for-profit entity, is that we, in this moment, help people understand that they have the power to take care of and um, help themselves. And when it comes to, for example, eating healthy, I know that there's like an idea that it's super expensive to eat healthy, right? Well, turns out to be the case that the healthiest, some of the healthiest foods in the world are actually very, very cheap, right? Whole grain rice, even regular white rice, beans, a variety of beans, um, obviously mixed like vegetables, a variety of vegetables, potatoes, things like that. These are actually very, very cheap products, right? So, I remember growing up, I didn't think that we were poor or anything like that, but we always ate a lot of spaghetti and we ate a lot of beans and rice. And, as I became an adult and started cooking for myself, I just realized that these are just like very cheap, options to eat, but they also are health promoting, right? Especially if you're getting in the whole grain versions of them. And so it just comes down to what our priorities are. If we want to experience a certain lifestyle that comes with some expensive options, and then I get it. It will be hard, right? But if we can again educate ourselves and help people understand that it is affordable, no matter your circumstances, to eat well and eat enough. And so hopefully we, like, our general message is like helping people understand that's possible. And just to speak to the health score a little bit, it's a number between 0 and 1,000 that represents your overall health. And it changes in real time depending on how you change. And the main reason that I created that was because I want to communicate clearly to the Black community our current health status, because I don't think we know. And when people see their score, especially if their score is low in a particular category, it makes it a little more real for them. Health is complex, and to be able to simplify it into an individual score may be the motivation that they need. Because once you do have the motivation that you need, all of a sudden things become more accessible. There's a few, as you probably know, there are a variety of factors as it relates to accessibility of something, right? There's affordability and availability. And honestly, for the most part in this country, and we'll see how those things change with this new bill, healthy food is affordable and available. And I say that with confidence in my experience, based on the focus of my studies in my public health program. You know, it's not necessarily that there's just not a grocery store nearby. It's that because of individuals' experience, the foods that we need to be eating or purchasing at the grocery store are not the ones that we choose, even if they are available. Like we've seen essentially that effort fail, and so and also feel free to push back on anything that you don't necessarily agree with. But yeah, I guess I'll stop there. But that's what I hope is that this is just another reminder that the country is never going to go out of its way to make sure that we all have what we need, and therefore we need to take that fully upon ourselves to make sure that we do.
Yeah, I'm definitely in the camp of both, and I definitely agree with what you're saying that it is we all need to take our individual place and make the choices and really step out and say like our health is our priority. We have these, I don't know, cultural, societal, familial habits, and maybe they are not or they have not been serving us, and we need to do better. And I also acknowledge that there are many, many systems, and a lot of the work that I work in like rural North Carolina, and there mightn't even be a grocery store. So I do acknowledge that a lot of people there do not have access, and even if they did have access, they I don't know, the median income in some of these places is like 25,000, 35,000, which is that's really hard to live on. And
Yeah.
yeah, but I do believe it's a both and I do believe that we need to both take accountability for where we are and where our family, friends, community are, and say, hey, we can do better, as well as we need to ask more of the systems and the environments and try to hold politicians and leaders accountable and able to build a system that is right and just, especially for those people that are most vulnerable.
Mm-hmm.